What is aspirational healthcare? And
Aspirational healthcare is everything we know our current system is, but so much more. It's journeying with people on their path to where they reach their destination.
sounds great. And the question that always comes to my mind is, okay, is it make believe?
The NUCA system of care, which is a healthcare system built by Alaska Native people up in Alaska, about 65,000 people through what's called the South Central Foundation, actually coined this term because they had the opportunity many years ago to build their own healthcare system. And now countries from all over the world go to Alaska to learn about this amazing, best-in-class, best healthcare system in the world. They asked the customer what they wanted. People said, we don't just want a paternalistic system that tells us what to do or fixes when we break our bones. What we want is a healthcare system that partners with us as we journey through life to live life to its fullest.
What are the results?
They're the only healthcare system that's won the President's Malcolm Baldrige Award twice. Their patient outcomes are amazing. Their patient satisfaction is 97%. Their employee satisfaction is 95%. And what's really amazing is they spend about half as much as the rest of the United States in healthcare.
What is it that employers can learn from that system?
Well, that is the purpose of this year's conference, is to literally share with employers that by understanding the principles that the NUCA system built their system on, they actually can implement an aspirational benefit for their employees, which is far better at addressing mental health, emotional well-being, creating stronger relationships with their employees. But it's all about understanding the principles and then simply following those principles.
What are the principles?
They are alignment, relationship, and choice. So let's start with alignment. What do we want by spending this money? Measuring to see if you're accomplishing your goals.
That's really interesting. So repeating it back to you, it's establish what your goals are, which logically should be anchored in how much am I spending? Am I keeping people healthy? And do they like it? Is it easy enough to use, and or is it having an impact on their lives? Then we bonus our healthcare teams according to those goals and make it known throughout the organization. We don't keep the goals secret, presumably. Mm-hmm. And then we can also incentivize other intermediaries or stakeholders like your broker, consultant. And
the whole idea would be the whole system working to help you reach your goals. Right now, this absence of alignment allows the whole healthcare system, from the point of the broker through the insurance company to the providers, everyone in the system is rewarded as costs go up and as the employer isn't getting their business objectives. I had the opportunity to run 10 different hospitals all over this country. As I had this epiphany, looking at continuous quality improvement, that I literally get away every day working against my customer. I mean, the employers who pay for my services, I literally scheme and am rewarded every single day to work against them. Now, it's an industry that's not being held accountable.
What do you do? Because everybody's busy.
The first step should be to simply take some time and write out what your goals are. It really is that simple. What are you buying healthcare for? And once you write those goals out and you prioritize them, apply measurement tools, ways to monitor. It could be as simple as surveys out to your employees to see if it's working. If you've done that and then you align the system based on rewarding the system for helping you get that, you have made a massive step in the right direction, and that doesn't take very much time.
What can I do to create relationships amongst all these families who work for me?
We have got to build a better primary care system, like the one NUCA built, where primary care, the front door to healthcare, is relationship-based. Well, there's a different way to do primary care called direct primary care, which is a subscription model. And it's quickly growing across the country. And Lee, I know you've been a big supporter of this, but the idea is you have far fewer patients, just like the NUCA model. They're each paying the doctor a subscription, a monthly amount every month. They're not, the doctor's not billing insurance. They're not getting paid fee for service. They're getting paid so much money. And now all of a sudden they're aligned with the patient and the employer to keep the patient healthy. The whole model is realigned. And so employers, if they'll just spend their money differently, I say this all the time. It's not about just buying an insurance plan, washing your hands and saying, I bought a plan. It's about taking the money you're already spending, in many cases spending significantly less, often 20 to 50% less, just spend your money differently in different buckets. So put money into catastrophic care. That's important that you have a way to protect from catastrophic care, but put money aside specifically for your employees to have a different experience with the front door to healthcare.
It's giving people option, letting them know that there's a different system available, encouraging them to try it out. Some people will say sure, and you make that super affordable by paying for it. What are or other relationships, I guess, outside of just primary care that people should have?
So we promote 3 relationships. In our case, we're suggesting that the health benefit that employers build offer up systematically the opportunity to have a relationship with a doctor through direct primary care.
Okay.
But it's going to be hard to really train all primary care physicians, DPCs, to be influencers. You want your employees to have a relationship with someone that's like a third-party accountability partner, an influencer, someone who's going to walk the path with you, be on the journey, helping you succeed. You're giving people an incentive to work with a coach whose design and purpose is to help change behavior and really help that person reach their aspirations and reach their goals. Now, the third relationship is a benefit expert, a navigator. And what you'll find is that in many cases, by simply the employees having that relationship and going through that navigator and contacting that navigator, in so many cases, the deductibles are waived, the co-pays are waived, the co-insurances, the out-of-pocket maxes. I mean, it's all waived, all that confusing stuff. But because you go through a navigator, can completely be waived, and you now make healthcare simple. You'll hear from companies that do that, and they're literally managed plans where there's no cost to the employee.
Is that no cost as in no like copay and deductible, or no cost as in no premium, or both?
You'll hear from employers that are literally paying 100% of their employees' healthcare because they're applying these principles. So not only does the employee not have to pay for a portion, like in John's case, he charges the employees 25%, they're getting everything paid for, which is an incredible retention tool. And because it's only costing them 50% less overall, because they're routing people to the best-in-class providers, you're getting better quality care, and you're avoiding a lot of the healthcare. Healthcare costs half. NUC approved. You can spend half as much on healthcare by being aspirational in nature, which is going to be a much better approach at attracting and retaining employees.
How does choice factor into this and saving?
What we mean by choice is this. It's the third fundamental principle of the aspirational model. Choice is where so often employers can reach 20 to 50% savings by simply giving their employees choice. And there's a principle that we've been advocating for and that we built into the system for many, many years that's strangling employers. And that principle is that if it's not good for everyone, it must not be good for anyone. If you take a defined contribution strategy and say, look, here's my money. I will let you choose what's best for you and your families. We're finding that many employees are saying, gosh, if I look at all the options out there, including some alternative ways to pay for catastrophic care, accessing health care at a cash pay price. I don't think people realize that cash pay can save tremendous amounts of money. So not making your employees be forced into a traditional system and allowing them to make choices and allowing them to purchase what fits their family best can literally save 20 to 50% on total costs.
Is it one kind of design, or is it many different designs just organized around the principles?
It really is many different designs around the principle. Now, do we have some specific things that we might recommend? Yes. But again, it's creating that alignment. It's building in those relationships. It's using choice. And when we talk about a choice, we often like to encourage employers to use that defined contribution strategy in 4 separate buckets. Have a bucket for catastrophic care, but then have another bucket for primary care, but I talked about. I'm going to give you $1,500 for you to have a subscription-based primary care. And then I'm going to put money over here into an incentive for you to work with a coach, to have a person to influence you to really accomplish your goals, reach your destinations. But then the fourth bucket is cash. Now, we've been using HRAs and HSAs in this industry for years, which is wonderful because it gives employees cash to then be a bigger consumer. We're suggesting employers and consultants take a close look at the new EB-HRA. The EBRA is Accepted Benefit HRA, is the most versatile product to give your employees cash, allowing the most different options, can be used with all kinds of different, including alternative ways to pay for catastrophic care, but it gives your employees the chance to say, I want to put it into medical savings. I want to put it towards a premium to buy supplemental insurance or long-term care insurance. Using the EBRA opens up the opportunity for choice for your employees more than any of the other accounts.
Maybe you could, just to wrap up this section, let us know where we can go to learn more about the model.
Absolutely. So on our aspirationalhealthcare.com website, you'll find a page called Steps. And on that Steps page, it'll literally walk you through the steps of implementing an aspirational healthcare model with your employees, where you identify those who hold the trust capital and can support you in this transition, because change is difficult. But it also will give you graphics explaining the different buckets and the different areas. So I would recommend you go there.